Okay, for ano naman, lumbar sacral plexopathy, meron tayo yung lumbar sacral, tas sacral plexus. Bro, di ko na nireview yan. I hate anatomy. But anyway, dito tayo sa femoral nerve injury. So yun, nerve injury, malamang natatarget si femoral nerve, the greater risk for injury. Tapos, ano ba? Manifestations, unilateral weakness and numbness of the usually, leg pain lang talaga siya. Retrolingual space under the lingual ligament, resulting in iatrogenic causes. So, usually iatrogenic siya. So, neuron cause siya usually. Tapos, meron siyang part dito known as the Meraglia paresthetica. So, di ba meron tayong tatag na Careglia paresthetica. Meron din tayong Meraglia paresthetica. Para sa paa naman to. So, ayun, purely sensory din siya. So, ito purely sensory din to. Ito purely sensory din siya. So, it's like the foot version of Careglia paresthetica or the waterburn syndrome. Papagod ako magsalita. Anyway, andito naman, yun ang two parts of the femoral nerve. Meron din tayo tinatawag na obturator nerve injury, which is also known as the obstetric palsy. Tapos yun, nagkakaroon ng problems sa sensations, sensations of medial time, which is adduction. So, like, hindi yung mga ganun yung paam niya. And circumduction gait ang problem. Okay. Moving on, sciatic nerve, alam nyo na yan. Pinag-aralan na natin si sciatica dati, pero basically, piriformis syndrome. Asan si fat wallet? Hindi ko ba nalagay si fat wallet? Walang fat wallet dito. Anyway, sciatica, basically, fat wallet to. Ito nalala ko, fat wallet to. Siyempre, mga mayayaman kasi nata-target yung sciatic nerve. Tapos, ayun, meron tayong piriformis syndrome. Asan si fat wallet? Wala ba yun dito? Okay, hindi ko na makita. Tamad na ako. Anyway, for sciatic naman, compression of the pelvic outlet affecting the peroneal portion of the nerve. And meron tayong sign, which is the Freiberg sign and the sign of Pace and Nagel. Okay, let's go here sa common peroneal nerve injury. Ito, naalala ko si Mikos dito kapag bubuhatin niyo basta kapag bubuhatin daw ito yung strawberry speaker, gagamitin daw yung paa para it's like this. Wala dito. Basta siyempre, strawberry speaker. Kapag nag-strawberry ka, nag-pick up ka ng strawberry, magyayari ito. Anyway, most common nerve injury the lower extremities and occurs in the fibular head. Fibular head, malamang. So, sa taas ng fibula. Tapos yun. Weakness in the DF and EV steppage gait. Okay. So, ito yung most common sa lower extremities, si strawberry speaker. And it's a common peroneal nerve ang nata-target. Okay, so yung una, femoral. Pangalawa, si sciatic. Pangatlo, si common peroneal nerve. After that, si tibial na. So, yun. Siyempre, si tibial, nata-target naman dito si tarsal tunnel syndrome. So, yun. Compression ito dito. Pwede siya maging, paresthetic and pain in the sole of the foot. Pero usually, most common, idiopathic din siya Pero ito, may part din si compression. Anyways, again, let's go on sa non-traumatic peripheral nerve. So, ito traumatic. So, basically, may external force na nangyayari. So, yun, kaya compression usually. Dito na kay Guillain-Barré. Kay Guillain-Barré is a classic autoimmune polyneuropathy and usually most common ng men. Tapos, most common is acute neuromuscular paralysis. Previously, polio naging most common, pero yun. It is also known as the acute anti-inflammatory demyelinating polyradiculoneuropathy, AIDP. Yun ang most common niya. Tapos ayun. Sige, pwede na yun. Basta yun, si Guillain-Barré, isa siyang classic autoimmune polyneuropathy. Tapos next, si naman for clinical manifestations, may skip na yun. Ito, aralin ko ba ito? Hindi, wala yan. Ayun sa Epstein, may pedophile dito. Anyway, let's go to the diabetes neuropathy. So, meron tayong tinatawag na which is the most common of causes of neuropathy. Tapos, symmetrical. and asymmetrical. Oh. So, meron tayong three kinds of neuropathy, which is the distal symmetrical, proximal, and focal. So, for distal symmetrical sensor, it is the most common type, plus insidious onset. So, delikado siya agad. Affects at least half of the long-standing diabetes. Ang proximal neuropathy naman is also known as diabetic amyotrophy. Older patients with type 2 diabetes ang nagkakos dito. Ito naman, natatarget si cranial nerves 3, 6, 7, and medial and older perennial nerves. It is 3 times more common than, ano yung seed diabetes? Hindi ko na alam. Basta yun, target dito, spontaneous recovery. So, nakaka-recover siya in 6 to 8 weeks. Ang focal mononeuropathy. Okay, moving on. Nandito na tayo sa Charcot-Marie-Tooth. It is most common inherited in PN. Tapos, ano ba maalala ko dito? It is referred as a hereditary motor. Ito! Mga pala, hereditary siya. So, naano siya by genetics and by how much naaano yung tao. Basta, heredity. Alam niyo na yan. Genetics, family, and stuff. Yun, so, slow progression onset starting in the first 2 decades. So, first 20 years, matagal siya. Okay. Tapos yun, Lyme disease. Easy na yan. Tick-borne. Lyme. It's siyang tick. Anyways, okay, tapos na tayo sa Module 2A. Kinayin, tangina. Okay lang, magki-cranial nerves tayo or I think cranial nerves na lang. Sige.